All right. Please give me your name and professional affiliation.
My name is LaToya Britt. I'm an oncology nurse practitioner. I've been practicing for over 5 years now.
How did you become interested in a career in medicine, specifically working with cancer patients?
I think as a child I knew I always wanted to do something helping people. Originally I wanted to just be a nurse, and then I thought I wanted to be a labor and delivery nurse, and after I did a round of clinical sessions in the labor and delivery ward, I realized that babies come when they want to, and so I wanted a little bit more autonomy. So I decided to go back to grad school, get a degree to become a nurse practitioner, and when I was trying to decide what I wanted to focus on, I had a lot of family members and a lot of friends that were diagnosed with cancer, and so I just kind of started doing a little bit more research, and I realized I like patients who are compliant, and so that was a very compliant population, so I focused my studies on that.
What exactly does an oncology nurse practitioner do?
Well, consider it going to the doctor's office. So what I do is I treat and diagnose cancer patients. So a lot of times our patients come in through the emergency room. They will complain of, oh, a stomach ache or pain or bleeding somewhere. And what the emergency room does is just stabilize them and initially treats the symptoms. And through the workup, they may discover that they have cancer, so they follow them up with an appointment to our clinic, which is a cancer center. And then what I do is I go through their pathology, which is basically the background about what type of cancer they have. We stage the cancer, we develop a treatment plan. I inform the patients of the type of treatment options they have available, try to answer all of their questions, go over symptoms and the plan, of course, for their entire treatment, and then I see them periodically as they get treatment. So it's a big appointment initially, and then follow-up is usually every couple of weeks, 2 to 3 weeks, depending on what the treatment regimen is. And then I decide whether or not they're safe to get treatment, to continue treatment, and we make adjustments the whole time.
So you work with cancer patients. I imagine that you see a lot of death in your, in your clinic.
I do. As you know, there are certain types of cancers that are curative. However, many of them are not. So a lot of times this journey encompasses the beginning of treatment, initial diagnosis, all the way to the end of life.
Okay. So let's talk about your personal beliefs a little bit before we get into it. What are your personal beliefs about death, dying, in the afterlife?
My personal beliefs about death, dying, and afterlife. I know that everybody has their day. That's my personal belief. Everybody has their day. I'm a Christian, so I believe in God. And I believe that hopefully the goal is to get to heaven. So depending on what you did with your life here on earth will depend on how you spend your afterlife.
What is in your mind? What's heaven?
Oh, what's heaven? Oh, heaven is just being in the presence of God, and it's nothing like it. It's absolutely amazing. It's just a peaceful place.
Okay. What's your cultural background?
I'm African American, from the South. A lot of love and good food and sweet people and a lot of church.
Okay. So you said you're Christian and you say you're from the South. How would you define your cultural and spiritual beliefs about death based on your culture?
I think that, to me, I find that Southern Christians, death is a little taboo. It's not, I think people avoid it, not so much as other cultures. I think Christians in the South, especially African Americans, they fear death, and not necessarily because they fear the afterlife. It's just not talked about, and even homegoing services are more or less, it's not always a pleasant thing. People don't like to plan death. They don't like to talk about death. They don't want to even think about it. And what I found is sometimes that mindset changes the closer the person and family members get to. But in the beginning, we don't even want to talk about that. So it kind of makes it difficult as a provider because at some point death is inevitable.
whether you're sick or not.
whether you're sick or not.
I imagine, you know, being that they do have cancer, it's a subject that can't be avoided, even if they have a curative cancer.
Exactly.
Okay, so have you traveled a lot?
I have. I've traveled a lot. I would say I'm pretty well traveled.
Okay, what have you seen in the places that you've been as far as death is concerned? Where have you been, and what have you seen as far as the death culture is concerned?
I've been to Asia, and in a lot of Asian countries, they're Hindu and Buddhist, and so they don't consider death as a final thing because they believe in like reincarnation and experiencing life as something else or somebody else or over again. So it's not the same. It's more or less like this is one life and then you experience life another time. So it's viewed totally different. And then I've been to Africa, and in a lot of African countries, they consider death as a transition, and you become an ancestor, and people can still communicate to you, and the spirit is still very connected to this realm, so they don't view death in the same way.
Okay. So you're well-traveled, and you work in a field where death is prominent. What were your feelings about death, or your ideas about death prior to becoming an oncology nurse and traveling?
I probably was the same way. Taboo, something that you don't talk about, something you don't look forward to. Just more or less, you know, let's put that on the back burner. And yeah, I probably was the same way. My perspective has changed a lot practicing.
Okay. Have you ever been responsible for planning a funeral or making funeral or burial arrangements for someone that you love?
No, I have never done that.
Okay. Have you buried someone that you love?
I have buried some. When you say have I, what do you mean have I?
As far as, have you been to a funeral for?
For a loved one, yes.
Yeah.
Okay. I have.
Okay. What percentage of your patients would you say are diagnosed as terminal?
Probably a good 60 to 70%.
60 to 70%? That's over half. That's almost all.
I say that because I've been doing this for 5 years, and the practice I was in initially was more or less end-stage cancer, so 100% of my patients were terminal. Now I work in a different environment, and I see a lot of people at the beginning of treatment, and some of them have early stage, meaning stage 1 to 2, and so they have a much better prognosis and can live and, you know, essentially be cured. But still, a lot of them are diagnosed with metastatic cancer, which is stage 4, which means that it's terminal.
Okay. If you had to give a number, how many patients would you say that you have treated that have succumbed to their cancer? Probably, if the magic number was 100 patients, I would probably say at least 70. 70. So you've had this discussion about death with several people in their families?
Yes, often.
How does that conversation go? And I mean, what is the family's reaction and the person's reaction to finding out that they have a terminal disease? And what is your reaction to having to tell someone that basically you're going to die?
It's tough. It is really tough. It's very, very overwhelming. I think I've gotten better at it just with practice and with just experience, but it is a very humbling experience, and it is very, I won't say traumatic, but it is something that makes you, as the person to have that discussion, I instantly go to a place in my mind and think about how I would feel if I were in that same place. So it's not an easy talk. A lot of times I think it depends on where the person is in their journey as far as how long they've been battling treatment, and you know what their support system is like. That makes a big difference, and just how long they've had to think about what, you know, if it's like I see you and then 2 months later, then sometimes people know, but a lot of times, you know, we see people the very first time I see them, then we recommend hospice because there are no options, and that's a lot. That's heavy.
Okay. What are the reactions of the patients? What questions do they ask?
Patients mostly ask, how long do I have? Which, I mean, I always say I don't have an answer. I ask them what their faith is a lot of times, because then it'll open up, it just opens up a freer conversation. And then you can make more or less kind of connect with them on a different level. But a lot of times they just ask, how long do I have? And I just say, you know, no one knows. But people want to know, do I have weeks? Do I have days? Do I have months? And that varies And even still, to tell somebody they have probably weeks, or even to say you have months, just makes it real.
Now, how is that determined?
A lot of times it's determined based on just research. We've done studies and the history of the disease, or where the person is as far as how aggressive the disease is, how sick they are. And honestly, after you do this for a while, you can basically have a good sense of how long people have to live. It's almost like a talent, like a gift. You just can see how close death is to people after a while.
Okay. So this is a conversation that you have not only with patients, but their families.
Mm-hmm.
The patient coming to the realization that they have a disease that will more than likely end their life
Mm-hmm.
in a relatively close time frame is totally different than talking to a family member who may be in denial or
Mm-hmm.
think they need a second opinion, or,
Mm-hmm.
you know, what else can be done. What is your conversation like with the family members?
That's complicated. I'm just thinking right now about a patient that I saw who, this was a family who, maybe there were like 3 or 4 siblings, and this was a brother and sister who came together.
Both of them had cancer?
2 other siblings had cancer. The sister was taking care of the brother who had cancer. So he was the 3rd sibling with cancer, and she had lost 2 previous siblings, like maybe within the same year, to cancer. So the brother was homeless at the time. He was on drugs, and she took him in more or less like, you're my baby brother. I'm going to do everything I can to keep you alive because I've lost too many of my siblings already. So we treated him. For about maybe 4 months, and then he just started to progress, and he wasn't as strong, and we got to a point where treatment was no longer going to be a benefit. And so I told him that, you know, I thought it was best that we got to a point where we were going to stop treatment, and he was okay. And when I left out the room, I always ask, are there any more questions, and they both were fine. And when I left out the room, the sister asked me, you know, she wanted to know, well, how long does he really have? And he had asked us that same question, and I told him, you know, we don't know, you know, weeks to a month at best. And then when I walked out the room, she asked me again, it's, you know, kind of, because people, sometimes they just need to hear it again. So, you know, I just repeated and told her I didn't know, and just to use these last couple of weeks, or, you know, whatever time was left, to make the best of it.
Okay. Would you consider it fair to say that because you are considered the professional in these situations, that you play a large role in guiding your patients through their death and dying experience and process?
I do. I realize now that my approach, or our approach as the healthcare team, the way we handle the death and dying process, the way we talk about it, the way we present, you know, options to the patient as far as palliative care and hospice care, gives the perception of what to look forward to. So a lot of times people are scared and afraid, and if they feel like they are being pushed out of the hospital or being pushed out of you know, wherever they're getting their care from, just to be left with no other options, then they don't think of death in a positive way, or they don't think of the dying experience as something pleasant. But if it's kind of, you know, discussed that we want you to be comfortable, we want you to be around family, we want you to enjoy, you know, the time that you have remaining, then the transition is generally better accepted.
Would you say that some of your patients are ready to die?
I will say that some of my patients are ready to die, yeah.
Why?
I think that people don't understand, but sometimes I say the beauty of having cancer is, and it depends, you know, of when you got diagnosed and how much time between diagnosis and to the point where you get to where we discuss hospice or palliative care options. I tell people that there is a certain beauty in that, because you get to make amends with family, you get to reach out to people, you get to, sometimes people take trips, sometimes people look forward to certain things, and you get time to reflect, versus if you get hit by a car and you didn't even know that was gonna come to you that day. So I do think there is a certain beauty in having a terminal diagnosis, because you do have time, and that's what people really want. They want time to think about it. They want time to tell whoever it is that they love them. They want time to reflect on their life. They want time to share those last special moments, and you do get that.
Why do you think it is that we don't take advantage of those opportunities every day without having cancer? At least not knowingly.
I think that people forget that life is a gift. I think we just, as human beings in this fast-paced world that we live in, everything is sped up. I think that people just forget to appreciate every single moment, and that is what I do appreciate about my job, because I'm humbled and reminded of that. Like, I see young patients, older patients, I see family members, and I'm reminded that every single day is a gift. So you do have to appreciate every moment, because it's not promised.
Okay. Now we're going to backtrack a second, if you don't mind. You talked about how heavy the conversation is with families and patients when they're diagnosed. What formal training do you all receive as medical providers to have those conversations? And would you say that many of your colleagues have the bedside manner that you do?
I will say personally, I have never had any formal training about having a end-of-life discussion. Perhaps maybe in a class or two, it was a couple of slides on a PowerPoint, but not really. I watched the doctor that I worked with when I first started practicing. I just kind of watched how he delivered care and the things he would say, and I tried to kind of keep that in mind going forward. And I just, I always have in the back of my mind, what would I want someone to say to my mom or to somebody that I love? So I try to use that as a guide. And a lot of times it just depends on the relationship you have with the patient about how you can discuss it. But, maybe social workers or maybe therapists get those real deal formal training, but I didn't. I just kind of discovered how to do it, and I hope I do a good job at it.
Okay. What's off limits when discussing death with your patients?
Honestly, I don't really think there are any questions that are off limits. You try to separate your own personal beliefs about the way people go about dealing with things and the choices they make as far as how they want to end their life, as far as, like, do they not want to get hospice? Do they want to go home with family? Do they just want to try to not treat when they have that option? The only thing that's off limits is more or less telling people what to do. But, good care is providing people with options, giving them as much information as possible, and then helping them meet their goals.
You process the loss of a patient, and which emotions do you feel when you learn a patient has died?
This just depends. I probably am a morbid person to the general population, me and my colleagues collectively, because when you work in an environment where you lose people all the time, you have to be able to compartmentalize. It sounds so bad, but it's true. I may see 12 patients in a day, and one of them may be terminal, and one of them may have the discussion about death, and I can't carry that conversation, or I can't carry those emotions into the next patient's room because it's unfair to the new patient. And you just have to learn how to separate every patient from one another. So depending on the type of relationship, some patients I just connect with better. I have a better relationship with them and their family, and then some patients I don't. So sometimes the emotions are like, wow, and then sometimes it's something where you need a moment and you have to, like, reflect and try to gather yourself. So it just depends, but there are a different range of emotions, because at the end of the day, these are all people that I've cared for in some sense.
Okay. How do you achieve balance in your personal life and not take the grief and loss that you experience on the job home?
I try to take vacations every few months, just because I learned my first 2 years, I didn't take a vacation for almost a year and a half. And I did not realize how stressed I was, because I thought I wasn't stressed. I mean, I do enjoy what I do, but I didn't realize how much of a burden that is when you think back. Me and one of the nurses that I used to work with, we were really good friends, and we would every couple of months just talk about, oh, remember this patient, remember that patient, and we would go through cycles, and it would be a whole group of us, and after a while you had named maybe 8 or 10 people that, had passed, and then you start thinking like, wow, that's a lot of people. And then I'm like, well, I have all of these memories of these people who I never see again, and it builds up. So I try to take vacations.
Okay. What do the vacations do for you?
Oh, they're like a little rejuvenation. I'm refreshed. I just kind of like let go. I just kind of lift some of that weight lifts off of me, and I didn't even realize I was walking around with all of that. So it's a big deal. I don't take them lightly.
Do you attend the funerals of your patients?
I've attended one funeral of a patient. I attended one funeral of a patient, and it wasn't a typical funeral. This was a patient that we got. When I say we, it was the staff that I worked with. We got really close to this patient, and he was young, and we would go on outings with his family. We got really, really close, and so they invited us to his funeral. I've been invited a bunch of times. I'm usually working, but I've been invited a bunch of times, and I actually went to this one.
What was it like for you?
It wasn't a typical funeral because they had a ceremony, and then they more or less had a life celebration, and it was in like a big, I'm trying to describe where it was. It was in a big, like, convention center almost. It was a big deal, and it was fun until his wife spoke, and she was so passionate, and then it kind of got sad. But I think we needed it, like, as far as closure. So I'm glad that I attended that.
What role does body donation play in medical academia and the practice of medicine?
Body donation. Personally, I don't really know, but I'm sure in medical school they use cadavers, and somebody has to donate those, and you need real bodies so people can see what real anatomy looks like. I think it does help progress the profession because people need to practice.
Okay. What would you say the medical profession and funeral would you say that the medical professional and funeral service are dependent upon one another for survival? If so, why? And if not, why?
Are the medical professional and the funeral? I think the funeral professional needs the medical profession for survival. If people don't die, then they don't have anybody to do business with. But I don't see how it goes the other way. So I think it's kind of one-sided. I would say maybe.
Okay. Do you feel as if we would be as medically advanced if we were without funeral service or those who cared for the dead?
Oh no, I think you learn a lot from dead people. I mean, that's why we do autopsies and stuff like that. And people just go, oh, well, what do you do the autopsy for? So then you can determine like why they died. But a lot of times that's how we make new discoveries, because we may be looking for one thing and discover something else. And then you'll go back and do research on something you found just, in the autopsy. So I think they do go hand in hand. It's very important.
Okay. So would you consider a medical examiner a funeral service professional?
Well, now that I think about it, I want to retract my statement about what I said earlier. They do rely on one another. Yeah, I think that funeral practitioners are probably just as well versed in the knowledge of bodies and anatomy as somebody in the medical profession. They just see the person after life has passed versus seeing somebody alive. So I think they are just as important. I think they are just as intelligent. I think they are just as versed.
Would you be able to work with the deceased?
Would I be able to work with the deceased? I don't know. I guess I would. I'm sure I could probably rise to any occasion. I know when I was in school, I had a classmate who we were in school to become nurses, and she was actually like a medical assistant on the floor. And she was saying a lot of times she would have to go in and after they had pronounced someone dead, before family came to identify the body, she would have to more or less kind of clean up the patient, and she would remove, different like oxygen from the patient. She would take out, IV lines and things like that. And she was saying how she thought her job was so important because she wanted to make sure that when they went in to see the body, and this is before, they get them out the room. Sometimes family is like close or something, and we would call and say, you want to come say goodbye to the person, or even before somebody else got in there, she would try to clean them up. And she said she felt like her job was so important because she wanted them to be presentable before their family saw them. I remember me and my friends were like, oh my goodness, like, aren't you scared? And she was like, it's so eerie because they still seem like they're there. Like, we've announced them dead, but you still feel like the person is still there. And she said she would go in the room and talk to the person and just say, you know, it's okay, and you know, I hope his transition is good. And she said the whole time she would be cleaning them off, she would just be talking to him. I'm just going to take this out and take that out. And we were like, why are you talking to him? And she's like, because they are still there. She's like, I wouldn't want somebody just cleaning me up and not acting like I was still alive. And I was like, but they're dead. And she said, yeah, but they're still there. And she was like, you just kind of have to experience it. I can't explain it. So I think I can understand now being closer to people closer to the end of life. I get it.
Have you seen someone die in front of you?
I have not seen somebody die. I have seen somebody die hours later. Well, I mean, I saw them hours before they died, but no, I've never witnessed anybody take their last breath.
Okay. I have one more question for you. How do you want to be remembered, and what do you have in place for yourself for your end of life care?
I think I probably vacillate with my answer. I don't think I want to have a open casket anymore. I think I probably would like to be cremated.
Why?
Just because I feel like people don't quite look like themselves, and so I want to be remembered full of life. So I would rather, if your last memory of me is of me like laughing, fun, living, breathing, then I want most of the people who know me to remember me in that way. I've been to funerals where you saw the body, and I've been to funerals where the person's body was not there. And I always feel like, for me, I think in the funerals that I've attended, I've walked away with a better, it's more positive. I think that body is a reminder of that person being dead. I think when you see the body, it reminds you that their physical presence is not there, and you remember that, versus when the person's body is not actually present, you can only muster up images from the last thing you saw. So I think right now that's where I'm going. But I do not have anything set in place. I'm an only child, and my mother she is a black mother of a child, and she does not want to talk about it yet. So maybe a couple 10 years from now she'll be ready, but no, we haven't ever had that discussion. I tried, and she was like, I don't want to talk about it right now. So
what if you were to die right now? How would she know what you want?
She would not know what I want.
So what are you going to do about that?
You know what? I'm going to go home and tell my mama. Maybe I'll write something up. Maybe I'll go ahead and start working on my living will. So my plans will be.
Well, I actually have something I can send you that you can outline everything that you want. And you don't even have to give it to her. You can put it somewhere.
Just put it somewhere. That's a good idea. I had a friend who did that, and I mean, she wasn't sick or anything. She just had planned a funeral for a family member. I think it was her mom. She had planned a funeral for her mom, and she said it was so easy because her mom had spelled out everything, like what color she wanted to wear, what dress, how she wanted her hair to look, and she said her mom had planned it out, and she was already planning out her funeral. And I remember thinking it was a light conversation, so it wasn't sad, and she was just saying she didn't want her husband picking out her clothes. And everybody kind of laughed, and I guess I would be the same way. So I want a real pretty vessel if I decide to, if I do decide to get cremated. I want a real nice dish for my mama to keep me in. Don't put me in some raggedy urn. I want something fancy.
Well, God willing, your mom won't have to bury you. But
amen. Yeah.
It's a conversation that you guys need to have for each other, especially being that you're an only child.
Mm-hmm.
You are going to be responsible for making her arrangements should something happen to her.
I know, and I have tried several times to introduce that conversation, and my mom is scary. So she does not want to have that conversation. I think she thinks that if we talk about it, then that means that something is going to happen. And what I've told her is I don't want to be the person responsible for making all of these end-of-life decisions, because I know that, when that time comes, I'm going to be grieving as well. And so I just much rather things be in place. But we're not there yet. It's a work in progress.
Thank you so much, and that's it.
Thank you. This is LaToya Britt, and you've been watching My Story with Joelle Anthony, the Great Woman.